Good evening. My name is Zoila Jasmin Martin, and I am presenting the Trends and Theoretical Foundation in Healthcare Simulation. Good evening. My name is Zoila Jasmin Martin, and today I am presenting how to do an introduction in the setting of a simulation event. This is being prepared for my class, Trends and Theoretical Foundations in Healthcare Simulations. Class, in order to prepare for the simulation event, we will have an introductory class at the simulation site. This will be held the day prior to the simulation event from 11 a.m. to 12 p.m. Location will be the Community Health Clinic in room number 1. During this time, I will orient you as far as how the room will be set up. We'll have a chair, a bed, a vital signs machine, specialized stethoscope, and chest cover to be able to assess the lung sounds, and S-bar forms with the appropriate pens and pencils. Also, I'll show you where the debriefing room will be located and the logistics of the location of restrooms, telephones, food and beverage, and of course where you need to park. Also, as you know, we will be video recording this particular event, so I will bring all of the signed consent forms for your signature, which basically will just outline that we will have an embedded patient and all the explanations regarding confidentiality and psychological safety for all participants. In other words, we will talk about how to be respectful to each one of our cohorts for the student that will be actually performing and for the 30 of you that will be observing through the video conferencing area. Now, we will have volunteers if somebody would like to volunteer to be the student doing the performance, or we'll just do a drawing of all the students and whoever is selected can do the assessment. Since this is a time where we will be learning, there is absolutely no reason that anyone needs to be afraid or concerned that they will be ridiculed or singled out for any error that may occur. In a simulation environment, I will remind you that mistakes are expected. You are novice nurses, so therefore we don't expect you to know everything. We understand there's a little bit of anxiety, although we hope that this orientation will help you to get that anxiety under control and just enjoy yourself and immerse yourself in this learning engagement. Now, once again, one of the most important aspects of the simulation event is the psychological safety. Under no circumstances will anyone be permitted to ridicule another cohort or any of the staff. We have tried to create an ambience of reality so that you can take what you have learned in theory and apply it in a safe environment where you are not harming a patient. Now, let's talk a little bit about the embedded patient. That is an individual that is an actor. In this case, the lady that will be doing the embedded patients has been with us and is very experienced. She's an educator. So she will help you to go through the simulation process. There are certain cues that we have given so that in the event that you forget something, she's going to try to give you a little trigger and that will remind you what needs to be done, or at least you can analyze and ask the appropriate question with the answers that she is giving. So she is there to help. She's not there to test you. This is not a testing situation. Are there any questions? I believe I've covered everything that we needed for today. But I'm here, and if there are any questions, please let me know, and I'll be more than happy to help you with those. No questions? Okay, then I will see you tomorrow right here. You already know where to park, and we will be meeting from 9 a.m. to 9:30 a.m. for our pre-briefing before the simulation, and I'll go over a couple of things that we've already discussed. However, please, if you have not had an opportunity to watch the modules and read the materials that we gave you, do that before. It'll just make you feel a lot more comfortable, and also it will maximize your learning. So you want to take advantage of this situation. All right? Thank you. We'll see you in the morning. Bye-bye. Good morning, class, and thank you so much for being prompt in arriving. We will now start the simulation pre-briefing, going over a few of the rules that we need to observe and considerations, as well as giving you a little bit more detail on what exactly we are doing, and giving you the opportunity, since the orientation and the introduction, to see if you have any questions that we could answer before we begin. Alrighty, I believe it's 9 o'clock, so let's go ahead and start. First thing I want to do is I will introduce myself, and then I want everyone to introduce themselves and tell me if you've had prior experience with simulation, or if this is your first time, and any other comments as far as this style of learning that you have heard from others, so we know what your thought process is and your frame of mind before we enter the simulation room. Okay, I'll start. My name is Jasmin Martin, and I am the simulation educator, and my job is to design and prepare the classes so that the students can come and acquire the skills necessary to perform their healthcare duties with patient safety, also with confidence and good communication skills, so that our patients get well and have better outcomes and have a very, very good rapport with our medical staff. And let's start here, and we'll just go down the line. I think we have 31 students, so we'll just go down, and if you could briefly just tell us your name and a little bit about yourself and your experience with simulation. Okay, well, thank you so much. Looks like a few of you have had the opportunity to use simulation learning and have gained a lot from it, so that was very encouraging to your cohorts that perhaps have not had this experience. First thing we're going to do is just to set forth a few guidelines, and then just to give you very briefly where we're at, and then we'll begin the simulation right away. I want to review what psychological harm is, confidentiality, and the fact that we are here to respect each other, and also the embedded patients and the simulation staff. Now, as I had mentioned yesterday, emphatically, This is a safe environment. There is no question that is not accepted. There is no tolerance whatsoever for ridicule or belittling. Everyone comes from a different perspective. There's differences in cultural values and identities, and people that have lived in other environments other than the United States. So we need to be able to understand where people are coming from and allow them to share accordingly. Also, we understand that everything that is said and done here is confidential. The instructors and the staff do not disclose what goes on here. We don't make judgment values either. You're here to learn, and we're here to teach and to guide and to facilitate. So let's all try to go in with a mindset that even though we know that this is not a real patient, she is a real person, and this could very well be one of the patients or even a family member that you have. So you want whoever is assisting this particular patient to know very well how to diagnose, to do the assessment, and to work with the medical staff to get you better. So let's go with that mindset and trying to embrace the reality of what we're doing so that we can get the most out of this experience. If for whatever reason the embedded patient that we have says time out, we are to stop immediately, no questions asked, and it has nothing to do with your fault. It could be the person is sick, it could be whatever. But when you hear the word timeout, that is her safe word. That means that for whatever reason, she needs to stop the simulation. And then we have backup. So we'll just continue on, and you'll still get your education accordingly. Now we're going to review the equipment, which is, once again, you're going to have in room number 1 in the clinic, you're going to have a bed, a chair, the vital signs equipment. You're going to have the lung sounds with the stethoscope and the chest cover, as well as you'll have your vital signs machine. The SBAR reports are there, the pens and papers are there. We ask that you do not put pens or papers near the test trainer so that it doesn't get ruined in any way. And there's a little table there where you can do the SBAR portion. The objectives have, you've got the list of objectives in front of you that basically states that you are to go in and to identify yourself with and follow the protocol. In that regard, you're also to do the vital signs and to do the assessment. And then to come out and present the SBAR to one of the educators, which will serve as your advanced practice nurse practitioner, and then go back and do what she tells you to do. Okay? After this session, which is 15 minutes in duration, we will have a debriefing. You need to go immediately to the debriefing room. Okay, no deviations, because we want this to be fresh in your mind, and then we will spend about 30 minutes in the debriefing room, and then after that you'll be dismissed. Okay? We want to remind that everyone is a participant and everyone needs to engage, so take notes, ask questions, and take advantage of the opportunity to learn. Now, once again, we don't want anybody anxious or or afraid to make a mistake or afraid to ask a silly question. This is a learning opportunity, and that's how we view it. We will provide you with a patient history, and just to let you know, we ask that you not touch the chest area of the embedded patient, because we have the stethoscope as well as the chest cover. So whatever you would normally do, you do on those two items, because this is a hybrid simulation. So you've got 15 minutes to do this, and let's go in and begin. But before we go, I think we have 5 minutes. Any other questions? No? All right. Thank you so much. So in 15 minutes, so after the 15 minutes, remember everyone to the debriefing, okay? Thank you. You take care.